Tissues. The tissue is defined as a group of cells that have similar structure and similar function together as a unit. This is called as the tissues. A group of cells are form the tissues. Group of tissues are forming the organ. Group of organs are forming the organ system in our body. Ligament. Bone to bone connection is called as ligament, and tendon, it is a muscle to bone. Types of tissues or classification of the tissues. Mainly it is divided into four main types: epithelial tissue, connective tissue, muscular tissue and nervous tissue. And again this epithelial tissue is again divided into two main types: simple epithelial tissue and stratified epithelial tissue. Again simple epithelial tissue having four main types, that is simple squamous epithelial tissue, simple cuboidal epithelial tissue and simple columnar epithelial tissue and simple ciliated epithelial tissue. And coming to the stratified epithelial tissue, also divided into two main types, that is stratified squamous epithelial tissue and second one is transitional epithelial tissue. And again this stratified squamous epithelial tissue is having two main types, that is keratinized epithelial tissue and non-keratinized epithelial tissue. And connective tissue. This connective tissue also having two main types: loose connective tissue and dense connective tissue. This loose connective tissue also divided into two main types, that is areolar connective tissue and adipose connective tissue. And coming to the muscular tissue, the muscular tissue also having three main types: skeletal muscle tissue and smooth muscle tissue and cardiac muscle tissue. And coming to the nervous tissue, and that is the types of tissues. And now we will discuss about the epithelial tissue. This epithelial tissue is mostly present on the body surface, especially in the epidermis, and lined hollow organs, body cavities, glands and ducts. Means this epithelial tissue is present our body surface area, especially in the epidermis, and mostly it is present in the body cavities, glands and ducts. Epithelial tissue is a vascular but has their own nerve supply. It is having one blood supply. And this epithelial tissue also having two main types, that already you know this: simple epithelial tissue, stratified epithelial tissue. This simple epithelial tissue, four main types: simple squamous epithelial tissue, simple cuboidal epithelial tissue and simple columnar epithelial tissue and simple ciliated epithelial tissue. And stratified epithelial tissue already you know: stratified squamous epithelial tissue, transitional epithelial tissue. And coming to simple epithelial tissue, the simple epithelial tissue consists of single layer of cells. It is four main types. The first type is simple squamous epithelial tissue. It consists of a single layer of the flat cells. Okay, here this is the basement membrane and there is presence of flat cells, only single layer cells only present in the simple squamous epithelial tissues. And mainly this type of simple squamous epithelial tissues are present in the alveoli and Bowman's capsules. Bowman's capsule is present in the kidneys, especially in the one structure of the nephron, and alveoli is present in the pleural cavity, lung cavity. Mainly this type of simple squamous epithelial tissues are flat and single layer tissues are present in the alveoli and Bowman's capsule. This structure will be like the single layer structure. And second type is simple cuboidal epithelial tissue. These tissues are consist of the cube shaped structures. It is mainly present in the renal tubules and lining of the ducts of the glands. Okay, this is a cube shaped structure, that's why it is called as cuboidal epithelial tissue. This is forming like a cube like structures. And also here also present of the nucleus. And next type, simple columnar epithelial tissues. It consists of rectangular shaped cells and it is mainly present in the lining of the GI system. These tissues are forming like a rectangular structures and it is present in the ducts and GI system. And next type is simple ciliated epithelial tissues. These simple ciliated epithelial tissues also having the rectangular shape, but only one variation is there: cilia are present on their body. Cilious means there is a hair-like structures are present on the tissue's body is called as simple ciliated epithelial tissues. This is also having the rectangular shape. And this type of tissues are present in the respiratory tract and also ureters and also fallopian tubes. And coming to the stratified epithelial tissue, this is the second type of the epithelial tissue, stratified epithelial tissues. These stratified epithelial tissues are consist of several layers of the different shape cells. But simple epithelial tissues are only single layer of the cells are present. Coming to second type, stratified epithelial tissues are having the several layers of the different shape cells. And it protects the underlying structures from wearing and the tearing. And coming to the types of stratified epithelial tissue, it is also divided into two main types: stratified squamous epithelial tissue, transitional epithelial tissue. And this stratified squamous epithelial tissue is also divided into two main types: keratinized epithelial tissue and non-keratinized epithelial tissue. Stratified squamous epithelial tissue, it consists of flat shaped cells, and it is also classified into two main types: keratinized and non-keratinized. Keratinized epithelial tissues, mainly this type of tissues are found on dry surface area of the body, especially skin, hair and nails of the body. This type of tissues are present, that is called keratinized epithelial tissues. And non-keratinized epithelial tissues, it founds mostly on the wet surfaces of the body, especially in the oral cavity and in the anal area and vagina. This type of areas, there is a presence of non-keratinized epithelial tissues. And coming to the transitional epithelial tissues, this consists of several shapes of the cells. It is found only in urinary system. In the urinary system, mainly present of the transitional epithelial tissues, and there is a having of several shapes of the cells are present. And coming to the connective tissue, and this is the second type of tissues. The connective tissue, these tissues that supports the connects of other tissues is called as connective tissue, and also it is connect the other body parts. And it is most abundant and widely distributed tissues in our body, and it is also divided into two main types: loose connective tissue and dense connective tissue. This loose connective tissue also again divided into two main types: areolar connective tissue and adipose connective tissue. This loose connective tissue contains less fibers and more cells, and so cells and fibers are loosely arranged. In this arrangement, it is again divided into two main types: areolar connective tissue and adipose connective tissue. Coming to areolar connective tissue, most widely distributed in the body and present into almost every structure of the body, so it is called as the packing material of the body. This areolar connective tissue are present everywhere of the body, that's why it is called as the connective or packing material. It consists of fibroblast, collagen material and elastin fibers. And adipose connective tissue, it consists of adipose cell which filled with the single droplet of triglycerides in their cytoplasm. And what is the function of adipose connective tissues? It reduces the heat loss and it serves the energy reserve and support and protect the body organs. Dense connective tissue, it contains more number of fibers, so cells and fibers are compactly packed. Example is tendons and ligaments for the dense connective tissue. And what is the functions of the connective tissue? The connective tissue is having so many functions here. It binds together and it is giving supports and strengthens the other body tissues and insulate and protect internal organs of the body, and it can storage like adipose tissues, especially it is storage the fat cells and main site of immune reactions and like Kupffer cell and macrophages. And the third type is muscular tissue. The muscle tissue is composed of cells that have this special ability to shorten or contract in order to produce movement of the body parts. This muscular tissues, especially this is useful for the movement of our body. It is also dividing into three main parts: skeletal muscle, smooth muscle and cardiac muscle. It is divided into two main types: voluntary muscles, involuntary muscles. In the voluntary muscles, the skeletal muscles will come, and involuntary muscles, smooth muscle and cardiac muscle. Here voluntary muscles, skeletal muscles especially, voluntary means when we want to move, that time only these muscles will give contractions and movement to our body. That's why it is called voluntary muscles. Involuntary muscles here, without our permission, our muscles are doing some work, that is called as the involuntary muscles. Coming to voluntary muscles, the best example is skeletal muscles. The skeletal muscles are long, cylindrical in shape, unbranched and multinucleated structures. This is the example of skeletal muscle. And coming to the involuntary muscles, smooth muscle and cardiac muscle. The smooth muscle is long and point end it will be there. This is one point end, this is also one point end, and spindle shaped it is having, and single nucleus is present in their body. And coming to the cardiac muscles, it is having the branches like structures, branches it is having, and cylindrical and multi-nucleus also it is having in their body. This is called involuntary muscles. The last type of the tissues is nervous tissue. The nervous tissue is found in the brain and spinal cord and nerves. It is responsible for coordinating and controlling the many body activities with the help of neurons.